The New York State Office for People with Developmental Disabilities is committed to providing a safe and healthy work environment for our staff, volunteers, and family care providers. This training does not replace any initial or annual training requirements in infection control and bloodborne pathogens. In this refresher, we will focus on reinforcing the basic elements of infection control to prevent the spread of communicable disease, reviewing the use of standard precautions, which is the most effective way to prevent the spread of infections, and emphasizing the use of personal protective equipment, which is a component of standard precautions. The purpose of infection control is to protect the health and welfare of the individuals we serve and our employees by controlling the spread of preventable communicable diseases. All employees, regardless of their job title or work task, are responsible for adherence to infection control practices. There are many different measures used to prevent the spread of infection. These measures are employed as part of standard precautions, which are the basic steps that every person should take to prevent the spread of germs and contagious disease. Standard precautions are a set of infection control practices used to prevent the transmission of diseases that can be acquired by contact with blood, bodily fluids, non-intact skin, including rashes, and mucous membranes. Hand hygiene is the single most important practice to reduce the transmission of infectious agents. Hand hygiene includes using alcohol-based hand sanitizers, hand washing with soap and water for at least 20 seconds, and changing gloves between tasks and between individuals. When should you practice hand hygiene? Before contact with an individual, after contact with blood, bodily fluids, or contaminated surfaces, even if gloves have been worn. After removing gloves, as wearing gloves is not enough to prevent the transmission of infectious agents in healthcare settings.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow-operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
Alcohol-based hand sanitizer or hand washing. In most situations, when hands are not visibly dirty, alcohol-based hand sanitizers can be used. It takes less time, is more convenient, and can be done anywhere. However, hand washing with soap and water is necessary when hands are visibly dirty or contaminated with blood or body fluids, after using the bathroom or assisting someone in the bathroom, before handling or preparing food, and when caring for individuals with any infectious process.
It's also important to keep your fingernails clean. Thousands of germs can survive under and around fingernails. Be sure to clean areas under fingernails if they are visibly dirty. Freshly applied nail polish does not harbor germs, but chipped nail polish can give germs a place to grow. People with artificial nails are more likely to have germs under and around their nails than those who do not wear them. In addition to standard precautions, there are other things we need to do to prevent the spread of germs in the environment. One of these things is respiratory hygiene, or cough and sneeze etiquette. Germs that cause illness, such as the common cold and flu, can be spread through the air when someone coughs or sneezes. In addition to the standard precautions already outlined, there are practices to follow when someone has a known infection for which the route of transmission has been identified. Droplet precautions are utilized when an individual has a communicable disease that can be spread through coughing or sneezing. Contact precautions are utilized when an individual has a communicable disease that can be spread through direct or indirect contact with the infected person or surfaces in the environment. Droplet precautions are intended to prevent transmission of pathogens spread through close respiratory or mucous membrane contact with respiratory secretions. These include the use of gloves and a surgical face mask at a minimum when providing care for an infected individual. Additional personal protective equipment may be required depending on the type of infection. Providing a surgical face mask to individuals who have a respiratory infection if they need to leave their room for personal care activities, such as toileting and bathing, when appropriate for the individual and the individual agrees to utilize the mask. Separation of ill and well individuals to the extent possible, and dedicated medical equipment for the duration of the symptomatic period. Blood pressure cuffs, thermometers, pulse oximeters, or other medical equipment should be dedicated to use for an affected individual and not shared during the symptomatic period if possible. Any equipment that must be shared is to be cleaned or disinfected as per the manufacturer's instructions before use with another individual. Contact precautions are used for a communicable disease that is potentially transmitted through direct or indirect contact with individuals or potentially contaminated surfaces in the environment. Contact precautions require the use of gloves and a gown within less than 6 feet of the ill individual to provide personal care. Also, you must maintain a social distance of a minimum of 6 feet between ill and well individuals. Use a private room if possible, and a separate bathroom if possible. If equipment is shared, ensure disinfection immediately after use. Personal protective equipment adds a barrier between you and potentially infectious material. Wear personal protective equipment if you anticipate contact with bodily fluids, which can include coughing and/or sneezing, broken skin, or other potentially infectious material. Personal protective equipment is also important if you work with chemicals. If you do not have an adequate supply of PPE, notify your infection control nurse or nursing supervisor. Gloves are the most commonly used piece of personal protective equipment. They should be worn for potential contact with bodily fluids, mucous membranes, contaminated body or environmental surfaces. They are also utilized when using chemicals for cleaning and disinfection. Be sure hands are clean before applying gloves. Cover cuts or sores with a bandage before putting gloves on. If a glove is damaged, do not use it. Single-use disposable gloves should be worn only once, then thrown away. If you're working with an individual with a contagious infection, know how you should dispose of gloves or other personal protective equipment. Gloves should always be removed and appropriately discarded after use with an individual. After glove removal, hand hygiene should also be done. Gloves must be changed when going between dirty and clean body sites. For example, after dressing a wound, remove your gloves, wash your hands, and then put on a new pair of gloves to administer eye drops. Gloves are meant to be worn when you are directly involved in personal care or a job task which requires their use. Wearing gloves when they are not needed can increase the spread of germs in the environment. Due to the risk of injury and death that can result from the ingestion of disposable gloves, in some work locations, gloves must be disposed of in a covered container or other designated area. Check with your supervisor to determine where gloves are stored and any specific requirements for used glove disposal at your work site. Wear a fluid-resistant gown if you need to protect your skin and clothing from exposure when contact with blood, body fluids, secretions, or excretions is anticipated. Remove the gown, discard in a waste receptacle, and perform hand hygiene. Never reuse gowns. A medical or surgical mask is used to protect the wearer from breathing in respiratory droplets and to protect the mucous membranes of the mouth and nose from contact with potentially infectious droplets and splashes. Face shields are designed to protect the mucous membranes of the eyes, nose, and mouth from splashes of contaminated body fluids or chemicals. Goggles or safety glasses are also designed to protect the eyes from splashes of contaminated body fluids or chemicals. Personal protective equipment should be put on in the following order. Put on the gown, tie in back. Then put on the mask. Secure ear loops behind your ears or tie the top and bottom straps. Apply goggles or face shield if required. And finally, apply gloves, pulling up and over the cuff of the gown. This illustrates the proper way to put on personal protective equipment. Personal protective equipment should be removed in the following order. Grasp the outside of your glove with the opposite gloved hand and peel off. Hold the removed glove in the gloved hand. Slide the fingers of the ungloved hand under the remaining glove at the wrist. Peel the glove over the first glove, and then discard the gloves in a waste container. This illustration shows how to safely remove your gloves. After removing your gloves, remove your goggles or face shield, touching the earpieces or headband only. Then remove your gown by unfastening the ties and pulling it away from the neck and shoulders, touching the inside of the gown only. Turn the gown inside out and fold or roll into a bundle and discard. Remove the mask by grasping elastic loops or ties and removing the face mask. Then wash your hands for at least 20 seconds. This shows the proper order of removing personal protective equipment. All personal protective equipment must be disposed of after each use. All personal protective equipment is single-use only. All items may be placed in a lined ordinary trash receptacle unless otherwise indicated as regulated medical waste or biohazardous material. In cases where surfaces are visibly dirty, it is necessary to remove the dirt, dust, body fluid, or other substances first. Always put on gloves and other personal protective equipment necessary for the job prior to the cleaning and disinfection. Detergents are designed to remove dirt from a surface. Surfaces must be clean before they can be disinfected. Disinfectants are designed to kill organisms, and some have residual activity that can prevent germs from accumulating on surfaces for a period of time. The product must say disinfectant on the label and must indicate what organisms it is effective against. All disinfectants have a specific contact time, which is the amount of time the product needs to stay wet on the surface to achieve disinfection. It may be necessary to apply disinfectant a second time in order to ensure the contact time is met per label instructions. Isolation and quarantine are disease control measures sometimes employed to help protect the public by preventing exposure to people who have or may have a contagious disease. These measures are put in place under guidance from health authorities based on the characteristics of the disease. Health authorities determine the type and duration of isolation and quarantine. Isolation separates sick people with a contagious disease from people who are not sick. It lasts for the period of time that the disease is considered infectious. Quarantine separates and restricts the movement of people who were exposed to a contagious disease to see if they become sick. Quarantine lasts for the duration of the incubation period of the disease, after which time health officials can be certain a person is not infected.
COVID-19 signs, symptoms, and risk factors include feeling feverish or having a measured fever greater or equal to 100.4, new cough within the last 7 days, new shortness of breath and a new sore throat. Risk factors include diabetes, persons with autoimmune disorders, elderly persons, lung disease, history of pneumonia, hypertension, and cardiac disorders.